Good day and great health. Welcome back to another edition of your Lifeline Vitality. Today on the podcast, hypoglossal nerve and the upper cervical spine. In upper cervical chiropractic, the focus is on the neurophysiology and biomechanics of the cranio-cervical joint. The four main sections to consider are the foramen magnum of the occipital bone, the atlas vertebra or the first cervical bone, the axis vertebra or the second cervical bone, and the brainstem of the nerve system. The nerve system in general does four main things. It controls all the movements we make, senses everything we feel, regulates all our body organs, and relates us to the outside world. To simplify, the brain stores information and generates electrical signals. The brain uses nerve fibers in the form of spinal nerves, cranial nerves, and peripheral nerves to send that information out to the body. There are also nerve fibers at every organ, gland, and tissue of the body that send information back up to the brain for interpretation. All the trillions of nerves that make up the nerve system communicate with each other in a complete, unbroken cycle. An important meet-up point in the nerve cycle occurs at the upper cervical spine. This is where the majority of nerve signals from the brain and body intersect. The upper cervical spine protects and surrounds the inferior section of the brainstem and superior section of the spinal cord. Let's look at cranial nerve 12, the hypoglossal nerve, and its connection to the upper cervical spine. The hypoglossal nerve is the most inferior cranial nerve located on the brain stem. It exits the cranium via the hypoglossal canal found on either side of the foramen magnum. Upon exiting, it travels down the neck, passing between the internal carotid artery and the internal jugular vein. It passes forward under the tongue to innervate most of the muscles of the tongue. The hypoglossal nerve communicates with the ganglion trunk of the vagus nerve, superior cervical ganglion, and the annus cervicalis, or the cervical plexus of C1 through C3. When nerves get stressed, it affects their sensitivity, perception, and behavior. There are three types of stress we deal with in life. The stresses are physical, chemical, and emotional in nature. These stresses create nerve tension, which imbalances the muscles of the spine. The nerve system will adapt to the best of its ability to these stresses and help bring the spine back into balance. If the stresses are too great for the nerve system to adapt, compensations arise. A compensation that occurs in the upper cervical spine is a vertebral subluxation. A vertebral subluxation will cause the atlas and axis bones to get locked in a misaligned position. This lock will perpetuate nerve tension, which imbalances the spine. A vertebral subluxation obstructs communication along the nerve cycle. This interferes with normal sensation, perception, and behavior of the nerve system. Nerve system function is disrupted. A functional disruption of the hypoglossal nerve will cause the tongue to deviate to one side when stuck out. It can also cause tongue paralysis and/or atrophy to occur on one side of the tongue. The goal of chiropractic is to correct nerve tension and spine imbalance. Chiropractors do this by adjusting the vertebral subluxation of the upper cervical spine. Correcting the subluxation better optimizes the function of the brainstem and associated nerves. The nerve system can sense, perceive, and behave at a greater potential when a subluxation is corrected.